My name's Jamie Zalloway Belcito, and I am the founder of Effie's Grace, which is an advocacy that focuses solely on positive policy outcomes for women in women's health outcomes. I'm also a postpartum specialist in regards to state level and federal policy, and I am a commissioner with the Commonwealth of Massachusetts on the Postpartum Depression Commission, which is now called the Ellen Story Commission for the Commonwealth. I came into contact with Ariel in respects to finding out what's happening around the United States, and specifically with New Jersey, because New Jersey is a state that has implemented a postpartum screening protocol since mid-2000s. And when I found Ariel, by way of her own personal story, as well as what she was doing with the Wilderman Fund and the Wilderman Foundation, it was very obvious that I should be speaking with her. I am also a mom who suffered from perinatal mental health complications myself. And first and foremost, I came at this issue from my own personal experience. Before I founded Effie's Grace, focusing on advocacy, and before I became a part of any push at the Commonwealth level of Massachusetts focusing on this issue, because this issue affected me personally, both of my pregnancies, and it was an issue that I was completely unaware of. In finding Ariel and speaking with her, it sounded to me that she also was not aware of the situation, and that we were both moms who were very happy to have had planned pregnancies, and we're looking very much forward to the deliveries of our children and starting our families, and we're completely blindsided by something that is the #1 complication of all pregnancies, and that is maternal mental health complications. This was an issue I dealt with in 2010 as well as 2013, and I had both of my pregnancies and both of my deliveries tracked and managed at 2 completely different care facilities, and experienced the same negative outcomes when it came to my maternal mental health and wellness. I was completely disappointed at the healthcare system in general, because having gone through it one time and then subsequently going through it again, access to any maternal mental health care was nil. I was faced with having to navigate an area that had limited resources and or very much hands-off by the healthcare providers themselves, wanting to deal with this issue, and myself, that I was led from one dead end to another dead end, and again felt that there was a link in my story with Ariel and what she had gone through, and that we were clearly failing moms at the basic level, societal level here, of having no opportunity to figure out what was going on, and completely lacking education in a very well-known area, again being that maternal mental health complications are the #1 complication of all pregnancies and postpartum. This is something that I think is a challenge for healthcare providers to handle, because A, they're either given 2 hours of education on the issue when they're becoming an OB, or they're being too rushed. The focus is solely on the baby. It's never on the mom's outcome in health and wellness there. At least my own experience, the proverbial you go into the office and it's, what's the heartbeat? Please drink this horrible glucose drink so that we see if you have an elevated sugar levels, if you're going to be pre-exposed to diabetes, are we looking at preeclampsia, et cetera, et cetera. And again, no one's asking me or Ariel or any mom, how are you feeling wholly? This does not separate from the biological composition of the being. The health and wellness, mental and physical wellness are one. And this is something that needs to be addressed in regards to focusing on the mom's health care, mental wellness, as well as equipping the doctors, primarily frontline being the OBGYN, because that's who you're seeing during the pregnancy. That's who moms are seeing during the pregnancy, but also the primary care healthcare setting and family practice that's seeing the mom post-birth, Generally speaking, with the OBGYN, unless there are complications, you're only seeing that OBGYN 6 weeks after the fact, and they're going to ask, how are you doing? You could be presenting with perinatal complications a week after you're home with that baby. You could be in a full-blown psychosis 2 weeks after the baby, or you could be completely beside yourself 6 weeks into it and having no idea what's going on around you. I found that to be my situation. I had no idea what was going on at 6 weeks, except for I felt horrible. I wasn't sleeping. I was exhausted. I really loved my daughter, but for some reason felt it would have been much better off that my own mom was taking care of the baby other than myself, and I knew that that wasn't how I should be feeling, or at least what I didn't anticipate feeling. And when it came time to voicing these concerns with the medical professionals that I would have assumed would have been able to support me, there was very little opportunity to figure out how to get me better. It was Xeroxed copies of a bunch of names of folks of whom I had no idea who these people were, that were told to me, you can call these people, they'll be able to help you. Or I can write you a prescription of Zoloft, and that was it. And to me, even in my fog, as a mom who was struggling with what I now understand was postpartum depression, that was depression and anxiety, which is why I couldn't sleep, I knew that that wasn't the right answer. There was no way that I was the only one that was dealing with this, and that I was at a birthing hospital. I was at a hospital, I will say, you know, you could do the hug a tree, pop a squat, and have the baby on one side of the road, and if there were any issues, you could go across to the hospital and have the medical intervention aspect of pregnancy there. And we had a women's health and a women's arts center focused on women's health, and there was not one person who could speak to this issue. So by way of my own journey launching into this, I felt that the mom's voice had been missing, that the health and wellness of the mom was completely taken out of the equation. And in seeing what Ariel's background was, in saying, hey, I had my challenges here. This was completely unacceptable. I love my son. I love my husband. I want for this to be something that other women don't have to be challenged with. Where is the root cause here? We look at reports from the American College of Obstetrics and Gynecologists, and this is an issue that they've been speaking about for years. The American Academy of Pediatrics actually came out with something almost 10 years ago saying we need to start screening moms for postpartum mental health complications, that this is completely normal. Let's take the boogeyman out of the room and let's start talking real talk. Just like we do going back with what's the baby's heart rate, or how is the baby developing, is the baby being fed well, and by the way, how are you doing? You're the main provider. 9 out of 10 times, the mom is the main provider. And that's what we need to take a look at, is who or how will this child be able to thrive if they don't have a healthy mom? I always liken it to what you hear on the airplane when the steward or stewardess is going through a case of an emergency, or if we lose oxygen, there will be a mask that will come from the ceiling. You will put it on yourself before you will put it on your child. And that's because if you can't breathe, if you don't have oxygen, you're unable to take care of your child. And that's what we're looking at. The second highest, and I believe it actually might be the number one highest rate of suicidal deaths for postpartum women, number one reason of deaths in postpartum women is suicide. And that is a direct correlation to maternal mental health complications. If we aren't taking care of our moms, and we aren't providing healthcare providers the necessary tools to take care of our moms, we are failing as a society. We are the apple pie. We are the bread and butter. We are the ones who are creating a healthier society. We are the ones raising the babies, and we are the ones that, if we don't have the tools in our toolbox to take care of our own families, these children will not thrive. I would even say systemically, when we're taking a look at behavioral health issues today, there are many women whom I speak with today that could even say conclusively, I was unable to attach to my child. I had attachment issues with my child. I had postpartum depression. And there's always been an issue between my child and I, and my child suffered from some behavioral health issues. These are preventative issues that we could absolutely take on as a society that will only bear positive fruit. And so taking a look at what the Wilderman Fund is looking to do through own experience. This is lived experience. This is someone and a bunch of experts and providers that are saying, I believe in what the mom's struggle is. I believe that this is something that we need to take the covers off. This should not be a mom in a corner at 2 in the morning crying, saying that this is happening to her. No, again, I'm saying it for the third time. This is the #1 complication of pregnancies. It's preventative. It needs to be talked about. If a woman is going to see their provider throughout their pregnancy, they're seeing a provider 29 times. That's on average. And if not once this conversation has had, again, complete missed opportunities just by way of not having the education or the tools there. So we're taking a look at, through the fund, how do we train providers? How do we give hospitals the opportunity to take care of their moms? How do we get midwives involved, nurses involved, psychotherapists involved, psychologists involved, community support systems involved? Really, it does take a village to raise a family, and the mom's voice needs to be at the center of this. If somebody told me prior to me having children that I was going to have perinatal mental health complications, first off, I wouldn't have even known what that meant. And secondly, I just would have said, absolutely not. That couldn't happen to me. And it happened to me not only once, but twice, and it was very unfortunate because the manifestations of what happened in those two different occurrences were completely different from each other. It was mainly anxiety, it was mainly intrusive thoughts, and it was anger. And I raise this because there's a spectrum of issues around the postpartum depression where it's not the mom in a corner crying, it's not this baby blues. We're talking at a spectrum of mental health issues, again, that have been well documented through the specialists in this field to say, here's what we're looking at. We know that this is what's happening. We know this is the #1 complication. We know it's 20 to 25% of moms who are pregnant. And when we take a look at a socioeconomic situation, 40%. When we take a look at vets who have PTSD, or any mom has PTSD, it's 1 in 3. Folks who have been domestic violence situations, sexual abuse situations, adverse childhood experience situations. There is a whole identifiable population that if there is an established relationship with providers and providers are trained ahead of time, we will absolutely be able to reduce via screening tools like the Edinburgh and via treatment programs like Ariel and her husband and her amazing family and that handsome little boy who I got to meet this morning. What we can do to make the Benjamins of the world in a happier place, for my Hadia and my Rose, in a happier place, for moms to say, you know what, I might not be feeling well, but I know that there are going to be support systems there, and that is something that the Wilderman Foundation and Wilderman Fund is going to be able to do with the experts on their board, with what they've already known, what they're bringing to the table, and being able to put the ball ahead of where we are right now as a society. We're reactive with how we're dealing with this, and we need a proactive approach. We have exactly the tools that can be put into place to make this a no-brainer and to make this part and parcel of what perinatal healthcare looks like. And that, to me, is where the future of this issue is going to be, is with partnerships with the Wilderman Fund and the Mom's Voice, which I'm very excited to be able to partner with them to bring that to the table as well.